We stand united by the imperative to act, the framework outlined in Closing the Gender Nutrition Gap, an action agenda for women and girls, will guide us through this two-part webinar series. In today's session, we will go through an overview of 4 pivotal areas of this action agenda, namely healthy diets, care systems, gender equality, and the multi-sectoral policy environment. Each area is fortified with a framework of policy and program recommendations, offering a roadmap for change. So thank you all for taking the time to join us today. If you'd like interpretation in French or Spanish, please click on the globe icon on your screen and you'll be able to access the interpretation there. Meanwhile, if you have a question for some of our panelists who will join us during the Q&A session, please type out your question in the Q&A box and we'll try and go through them during the moderated session later on. Ladies and gentlemen, the Government of Ireland was the donor of Sun CSN at a global level. They're also a donor of FHI 360, as well as Alive and Thrive, for which the next steps of the action agenda would not be possible. So please welcome for his opening remarks, Deputy Head of Mission, Embassy of Ireland for Vietnam, Laos, and Cambodia, Mr. Sean Farrell. Sean is unable to be with us live today, so here's his recorded message. We can't seem to hear Sean. Can we just check his audio?
What about now?
It's our gender equality.
Yes, we can hear now. We can start from the beginning, please.
Good afternoon, distinguished guests, and greetings from the Irish Embassy here in Hanoi, in Vietnam. I'm delighted to be here today with you all to speak about closing the gender nutrition gap. This topic brings together 2 key pillars of Ireland's foreign policy and our development policy. These are gender equality and improving nutrition and tackling hunger. Gender equality and the empowerment of women and girls is a central pillar of Ireland's international development policy as set out in A Better World. It is one of 4 key priorities, and it commits Ireland to ensuring that we have an overarching focus on gender equality and that women and girls is seen as being central in all of our partnerships and interventions around the world. In today's world, Ireland's focus on gender equality is recognised through the strength of our ODA programme. We also recognise that gender equality is both a fundamental human right and also an absolute key to achieving these sustainable development goals. Up to a quarter of the indicators included in the SDG framework implicitly or explicitly address gender equality, while we know that progress on SDG 5 underpins the achievement of all of the SDGs. As Ireland, we are committed to achieving this goal through our work with a variety of partners, including governments, UN agencies, and civil society. Global hunger and undernutrition is a key component of Ireland's foreign policy. And while we continue to provide emergency assistance in response to hunger and nutrition crises, our main focus is on the prevention of such crises. The current challenges around climate, we know, is now driving new challenges for us all. And we recognize that working across areas like climate, nutrition, and gender is absolutely central to make progress in the world we live in today. The good news is that initiatives to prevent maternal and child undernutrition are proven to be effective and practical, while also being low in financial cost. Given the important role that women play in food production and in family nutrition, we as Ireland ensure that programs and initiatives pay particular attention to their needs and experiences. For Ireland, this is done through a combination of initiatives. This includes the promotion of breastfeeding, hygiene, good childcare practices, and providing essential vitamins and minerals. It also includes assisting farmers to grow more nutritious food and the work that we do on rural development. Today, I'm really looking forward to the inputs. Emily Mates is someone that I know well and who we have worked with over many years. And Emily brings such a wealth of experience to this topic. Alive and Thrive on the panel today are a key partner of the Embassy of Ireland in their work in Vietnam, Cambodia, and Laos. And we find their experience in implementing the programs both amazing and of high impact. And we know that their sharing of this experience will be enlightening for all of us today. And of course, our partnership with Scaling Up Nutrition and the Sun Global Network remains as important today as it always has been. Thank you all for the invitation to speak at the launch of this event, and we very much look forward to all of the inputs here today and to the sharing of lessons, of experiences, and the sharing of practices right across the world. Thank you.
Thank you very much, Mr. Sean Farrell, Deputy Head of Mission, Embassy of Ireland, Vietnam, Laos, Cambodia area. Speaking of Emily Mates, she's the maternal nutrition specialist at UNICEF. And ladies and gentlemen, the UNICEF Flagship Nutrition Report 2023 brings to the fore the extent of the global crisis of nutrition in adolescent girls and women. So with us to explore the data, the reasons for the gender nutrition gap, and the impact of malnutrition on women and girls, please allow me to welcome Emily herself to give us her presentation. Emily.
Thank you very much, Neera, and thank you, Sean, for your kind words. You'll have to excuse me because I've got a Northern Hemisphere winter cold, so I'm a bit croaky and I hope I don't cough too much, but yeah, hopefully it'll work out. So yes, as Mira said, I'm going to just run through a little bit of data from the flagship report that we published earlier this year in, oh, we're flicking through. Can we go back to the beginning? That we published in March this year. And what we were wanting to do was set out a proper situational analysis to really see what the status of nutrition is for women and girls. And as we'll go through, you'll realize it's a bit it's not great. But one thing I want to say at first is that it's very challenging to really decide and look for data because there's very, very little data around women. Where there is data, usually it's only on infant outcomes. So we've just also been doing a big evidence review for some guidance for maternal nutrition in humanitarian context. And we found the same thing. Very, very little data, assuming all women are a homogenous group. For example, pregnant and breastfeeding women, they're going to have different needs. Adolescent girls and women, they're going to have different needs, but they're just viewed as one homogenous group. So we've got a lot of work to do to improve the data that we're collecting. However, we did find some data. First, I just want to show you, this is from the UNICEF Nutrition Strategy This is everything that we work from and towards for good nutrition for children, adolescents, and women. And it's all, as you can see in the bubbles there, around good diets, good services, and good practices. And on the right are the numerous factors that we all know that are influencing poor nutrition in this group. Next slide, please. Thanks. Oh, that one. I'm not going to go through all this. I just wanted to show you that we looked at a number of data sources: quantitative, qualitative, global and regional reviews, and global literature. So we drew from everything that was available to come up with the data and then the recommendations for the report. Next slide, please. And next slide, please. So yes, the subtitle is the global crisis, and it really is a crisis for women and adolescent girls, because progress has been too slow, and also it's under threat, and it's under severe threat. So we have triple threats at the moment: anemia, underweight, and overweight and obesity. Now, you might notice in the report we didn't actually report on overweight and obesity. We're going to do a piece of work next year on that. We kept the report to anemia and underweight, but we did an early graph, so I've snuck it in here so you can see. So yes, almost 70% of women and girls suffer from micronutrient deficiencies. Anemia obviously is a very major one. 1 in 3 have anemia, and at least 1 billion women are affected by the double threats of undernutrition, anemia, and or micronutrient deficiencies. And an enormous number of women suffering from overweight, nearly 500 million, just over 500 million. And just under half of those actually have the more severe form of obesity. Women are more affected than men with overweight and obesity. Next slide, please. So this slide, it seems a bit complicated. This is just the breakdown per region. So UNICEF has 7 global regions, and then there's one on the world figures. So underweight, you can see on the left-hand column, underweight in adolescent girls, barely no movement at all, really. Underweight in women, a small decline. The yellow line at the top is the overall global one. Oh no, that's South Asia. Sorry. Yeah, South Asia. And then anemia, some progress in some places, but also not in others. So there's no change in prevalence in underweight in adolescent girls, a very small decline of prevalence in underweight in women, and no change in anemia. And importantly, no region is on track to reach the 2030 global target to reduce anemia prevalence by half. And these graphs are 20 years. These trends are from 2000 to 2020. So it's over a long period of time. Next slide, please. This also was an interesting bit of analysis that we did in 12 countries around the global food and nutrition crisis, which, as you know, has been getting considerably worse over the past 2 or 3 years. And we looked at the 12 particularly crisis-hit countries, and what we found was that the number of acutely malnourished pregnant and breastfeeding has increased by 25% in a 2-year period. So it's gone from 5.5 million to 6.9 million. Some countries much worse than others, but it just gives you a good sense that any progress we have made is under threat from increasing global food and nutrition crisis and conflict. And we can see conflict is just rising all around the world. Okay, next slide, please. And an important finding is that poorer regions and disadvantaged adolescent girls and women bear the brunt of particularly of undernutrition and anemia. So South Asia and Sub-Saharan Africa are home to almost 70% of adolescent girls and women with underweight, and 60% of adolescent girls and women with anemia. Now, not shown on this slide because I've only got a short time, but we had other figures in the report showing that less educated girls and women and those living in rural areas or belonging to poorer households are also more likely to be underweight, too short, and or anemic. Next slide, please. No. Okay. Nope, there was one before that, I think. That's it. Okay, the gender gap in food insecurity. So I thought this was particularly relevant as we're talking about the gender nutrition gap in this webinar. So this again is due to the increasing global food and nutrition crisis. But you can see on these graphs that the difference between women and men suffering from food insecurity in the world has increased over the last couple of years as well. From 2019 to 2021, it more than doubled the gap between women and men who are food insecure. Next slide, please. And I know everybody knows, but it's very important that we remind ourselves that poor nutrition is passed down through generations. Now, this was a very interesting piece of work done by Andrew Merton and his team. And what this shows is that the majority of stunting, over 50% of stunting, is already established, already happening by the time the infant is 6 months old. Now, the red bars in this figure are stunting that has already happened at birth or within the first week of birth. The orange bars in the figure are 8 days to 6 months. So you can see more than half of stunting is happening when the child is either entirely dependent on their mother for nutrition, i.e. before birth and when they're actually born, and in the first 6 months of life where infants are generally entirely dependent on their mother. So the only solution to address this is to improve nutrition for adolescent girls and women. Next slide, please. I think that's it. I will now hand over to Deborah, and thank you very much for your time.
Thank you, Emily. If I could just ask you one question, Emily. Emily's going to leave after this because you're not going to be part of the Q&A session. I just wanted to ask you one question. How do we create a global movement to improve nutrition for women and girls, Emily? I mean, would you have any ideas?
Well, I think it's already happening. It's been great over the last year or two that a great deal of momentum has been building. We've really noticed that, I mean, I've been working in this field for 25 years, and it's honestly the first time over the last year or two that I've even heard people really focusing on adolescent girls and women. So at UNICEF, we're working really, really hard to strengthen our women's nutrition team and all the work that we do to support the regions and country offices. And many country offices are really, stepping up their programming for adolescent girls and women. And then we've got the gender nutrition gap work that we're going to talk about, you're going to hear about for the rest of today. So I think it's already happening, but what we must make sure is that we really make the most of this little moment in the spotlight that adolescent girls and women are having, because inevitably, other crises, other things happen, and we can move on. So I think the absolute key is to make sure that we really, really maximize all our efforts while there is some very good attention going on towards adolescent girls and women.
Wonderful. Thank you very much, Emily. And look after yourself. That was Emily Mates, maternal nutrition specialist at UNICEF, joining us today. And now we'll move on to the next segment of the program. Dr. Deborah Ash, she's the Senior Nutrition Advisor at Global Nutrition at FHI 360. Deborah's been instrumental in the coordination of this Gender Nutrition Gap Action Agenda. I cannot think of anyone else who would be best to provide an overview of the action agenda and how it all came together. Welcome, Dr. Deborah.
Great. Yeah, thank you very much, Mira. And it's my pleasure to share with everyone, and wonderful to see such a global audience for this webinar series. I'd like to let you know about the background on how we were able to pull together this close the gender nutrition gap. And if we could move to the next slide, please. Where we see, just as Emily has mentioned, we are seeing this wonderful momentum. We're happy that we've been able to really push this momentum along with this process of pulling together a global action agenda for women and girls. And so we did, after a nearly 2-year process, pull together a successful co-creation of this action agenda. And it was built by more than 40 organizations, and I'll let you know more about those organizations. And I can see that many of the partners are here in the webinar series today. And the exciting piece is that it was not only the creation of an action agenda in terms of laying out a framework, it also was an opportunity to work in several countries to be able to adapt this as we went along. And you'll be hearing as well in this webinar series on the work that was done in Nigeria and India. And ultimately, we were able to launch the action agenda and the campaign, and I'll let you know more about the details of the campaign, which is equally important in raising the awareness and really bringing this to many audiences. We were able to launch this at Women Deliver this year in July 2023. And the work was funded by the Bill and Melinda Gates Foundation, and we were asked by the foundation to deploy the assets of FHI 360's Global Nutrition Team, which includes the 1000 Days Initiative, the Alive and Thrive Initiative, as well as Intake, the Center for Dietary Assessment. And we had a team that stretched across several regions and globally to work on this together with multiple countries. Next, please. So for the couple of words on the development and co-creation process that led to this successful launch of the agenda, we went through a process of reviewing all of the formative research that we could find. And as you've heard from Emily, one of the important pieces of that was the report, the flagship report that came out in March of this year, published by UNICEF. We also had an opportunity to look at a lot of the UN agency reports and the various normative guidance out there. And there really is a lack of coherence and convergence around some of that guidance. And it's something that we have called out in the action agenda. And we had an opportunity to bring this forward to a very consultative process where we had partnership meetings, consultations with partners. We also had an opportunity to check in with donors and go through perceptions research with them on why is the issue of women and girls nutrition not reaching the places where we need it to reach? What can we do to accelerate the commitment to girls and women's nutrition? And finally, we had an opportunity to do stakeholder mapping workshops and policy reviews and opinion leader research in key countries, including Ethiopia, India, and Nigeria. And we brought all of this information to some thematic group consultations with partners. And ultimately, we came out with a framing for this action agenda. And we were able to really see resonance on certain key issues, and I'll describe those in terms of the key action areas. But just to mention, of course, what following what Emily has said, there really is a lack of information around this issue, and this was an effort to really bring that to light and bring it to light in a collective manner. Next slide, please. So as you can see here, these are the more than 40 partners who co-branded the action agenda, and this is not the only groups that were involved in this. There are members who are joining on as we move forward, and this is very much an open process. This represents a moment in time. Next slide, please. So we're very happy to see that there was such a resonance across the community, health, nutrition, as well as gender partners. And here in this slide, the aims of the action agenda quickly emerged, where we knew that as a group, we wanted to highlight the well-being of women and girls through collective opportunities and responsibilities, working at multiple levels. And very clearly, it became very obvious that at the heart of this agenda is the recognition that prioritizing optimal nutrition for all women and girls opens pathways to greater opportunities and achieves a productive ripple effect for women, their communities, and nations. So very much putting this in the context of national development, human capital development, equality. And the third bullet here, and you'll be hearing about this from the upcoming panelists, within the broad scope of women's and girls' nutrition, we honed in on 4 key action areas, and those are healthy diets, care, and by care, we mean the care system from both the health system side as well as social protection, gender equality, and we felt that it was very important to feature gender equality as a key action area, Much as we know, it's always there as an underlying determinant. We wanted to make sure this got put to the forefront. And then the fourth one, very importantly, the strong enabling environment. And we felt that this was where our partner coalition was best placed to foster change in policy, practice, and behavior. And the action agenda, as you'll be hearing more about across this webinar series, is providing a blueprint for achievable solutions that improve girls and women's nutrition, while at the same time advancing maternal and newborn health and gender equality. And it is a call to actors to re-energize previous commitments and reposition nutrition as a feminist issue, and critically come together to prioritize actions through a gender transformative lens. So again, very much putting gender at the center of this and building on commitments that governments have already signed on to through various mechanisms. Next slide, please. And so now transitioning to speak about the campaign development. This was very important for the work as well. So we went through this very rigorous technical piece with experts in multiple areas. And then at the same time, we worked with communications experts on a campaign to really elevate this and ascend this as a key issue. And next slide, please. Here you see the gender nutrition gap story. We had to find a way to position this, and we had an opportunity to work with a creative agency to get the kind of cut through that we were looking for in the social impact space, going beyond the echo chamber of nutrition or health partners, and thinking about this as well from a public facing perspective. And so the positioning here on the gender nutrition gap is the way in which women and girls' unique biological needs, disparities in access to food and services, and harmful social norms have a bearing on their health and economic outcomes. So trying very much to position this as not a health and nutrition issue alone, but very much impacting society at large. Next, please. So I'd like to spend a minute on this slide in really digging into how we went about crafting the gender nutrition gap story. And as we know, as we try to ascend issues, it's very important that we have a clear narrative around this. And we're quite excited about the collective action that went into creating even the narrative. There were several steps where multiple partners were involved in working on this together. And so I won't read across all of these points, but the main lines around this are that we wanted to balance out the urgency as well as not making it insurmountable. We wanted to make it accessible. And so we did call out that yes, it is complicated, that it's about food and nutrition, but it's also equally about biological needs and cultural and social norms, as well as government priorities and lack of political will, lack of data. At the same time, we wanted to present that it is simple. It's about nutritious food and who eats last, least, and worst. And this is something that was very clearly called out in the Undernourished and Overlooked report put out by UNICEF. And finally, the balance between it's devastating, but also preventable. We wanted to make sure that the magnitude of this came out very clearly, that it is about 1 billion women and girls worldwide facing undernutrition, that it does impact very much their life and has dangerous consequences, but at the same time, it is preventable, and that dedicated budgets and specific nutrition policies, as well as allyship and equal political power, can change this and can accelerate action on this. Next, please. And so where we wanted to land this, we were very ambitious in wanting to land this as a gender gap, like other gender gaps that we hear about in the discourse, and really make this part of the zeitgeist, where we're talking about the gender pay gap, we're talking about the gender data gap, gender tech gap. We want this to be equally seen as, gender nutrition gap is a gap that creates many other gaps. And we've seen that gender and gap have become synonymous to talk about inequality when speaking about women and girls. And again, referring back to the UNICEF report, that this also referenced the policy gaps and gender gaps in food insecurity another way of showing that our sector is using this terminology. So we went along that path. And next, please. And we're happy to report that next there. Yes, thanks. And we're happy to report that at the launch at Women Deliver, which was part of a concurrent session put on by FHI 360, the African Leaders for Nutrition, including Her Excellency, the First Lady of Ghana, who is a champion for the African Leaders for Nutrition Network, and Gender Health, UNICEF, the Micronutrient Forum, and Nigeria Health Watch. This created quite a buzz, and we were very happy to see that in the official closing memo of Women Deliver, the launch of the nutrition, gender nutrition gap action agenda was named as one of the top 5 takeaways from the conference. And so it clearly indicated to us that we're onto something here. We have an opportunity to continue the ambition that we have with elevating this issue. Next. And a couple of remarks that we've heard from partners around the world of why they think this particular positioning works is that it helps to modernize the issue of nutrition. It makes the issue understandable at a glance. And this is again referring to the communication pieces that came out around this, the communication assets, that it highlights the systematic factors at play, that it draws responsibility away from the individual to the powerful, and very importantly, brings gender and nutrition together. And as I mentioned, it taps into the zeitgeist and current conversations around the gaps, the gender gaps. And as we know, it's very important for a successful campaign to create a clear problem. And we know that it creates a clear problem that the action agenda can then help to solve. In my final slides, as we transition to our next speakers, the advocacy ambition is very important here. And as Emily has highlighted, it is a moment that we really need to galvanize and continue to capture the energy around the view on girls and women's nutrition and accelerating the action on this. Next slide, please. And so what we can see here is that the use of this global gender nutrition gap campaign for action on girls and women's nutrition, it's a resource for advocacy. And as you can see, many partners are already using this. You'll hear about this across the webinar series, that it is being used and can be adapted across communities to advance shared goals. It's meant to be and was designed to be a practical tool to guide advocacy. It's not meant to be a static document. And as I mentioned, we will continue to build out the coalition of partners, and we strongly invite partners and groups to join in on this and become gap closers. We have a dedicated campaign website to this. We will be featuring the logos as people join into this coalition. And most importantly, our ambition throughout all of this from day one has been about using this. And importantly, seeing that other partners are prioritizing this and programming on this and building it into their programming and advocacy efforts. And you'll hear more about the specific action areas from the upcoming speakers. Thank you.
Thanks very much, Deborah. That was Deborah Ash, Dr. Deborah Ash, Senior Nutrition Advisor, Global Nutrition at FHI 360. Now we're going to move on to the next speaker, and we're going to attack action area 1. We now, and this is the way in which healthy diets improve and support the gender nutrition gap. So speaking to us about action agenda 1, please welcome Buichepo Bibi Giyose, Senior Nutrition Advisor at the African Union Development Agency. Bibi.
Thank you very much, Mira, and good afternoon, everybody. Good morning, good evening, wherever you are. It is a real pleasure for me to join this important conversation, particularly in the backdrop of all the crises that we are seeing lately. And in this regard, women are usually not spared, and adolescent girls even more so. We all know that malnutrition and hunger is a global problem. It affects about 2 billion people, and 2 billion people suffer from macronutrient deficiencies. Unfortunately, the most affected tend to be women and adolescent girls, primarily because of their physiological build and status. And children also under 5, if they are not going to be getting the right healthy diet, are going to be too short for their age and they're going to be stunted. And we do know that more than 7 million, almost 800 million people do not get healthy diets. And unhealthy diets have been shown to be the one leading cause of global malnutrition and disease burden. If you don't have the availability, the access, the affordability, the utilization, and you have disease conditions, you're going to be unable to access a healthy diet, despite the fact that the world actually produces enough food to feed everyone. So the reality is that women have an undue, and this, next slide, please. Next slide. Yes, thank you. Women have an undue and disproportionate treatment and inadequate support in most circumstances. They suffer different forms of malnutrition, and in part because of the traditional and cultural practices. This exacerbates the situation. For example, in most cultures, well, in Africa, let me give you an example of Africa. Men are the ones who eat first and eat the best pieces. Children eat next, and then lastly, the women. And imagine it is the woman who's doing the toiling, preparing the food, being on the farm, and taking care of the family. And additionally, women, when it comes to farming, which is the source of providing healthy diets, they usually have no land right. So they cannot produce and not be productive. And early marriages in some cultures prevent girls from having the opportunities to go to school and be educated and be productive and be supported. And then the latest issue also is that of gender-based violence. And so, as some research has shown, women are often paid, as Emily said, less than their male counterparts for the same amount of work they do. So this inequality, we have to start rethinking and reprogramming our brains around how we bring about the topic. And unfortunately, and really, women do not sit at the tables where important decisions are made on their behalf. And it is really sad that decisions are made directly that affect them, but they don't have a say ultimately, globally, at the national, and even at the community, and even within the household. Next slide, please. Next slide. Next slide. Okay. In this picture, I just want to show you, this is the, go before, please. Go back. Go back, yes. Go back again, please. Go back again. Okay, in this slide, which I took this picture in Accra, Ghana, at the market. And I was just talking, forward, please. And I was just talking to some market women. And it is very clear that most of these women may have gotten up at about 4 in the morning, having gone to bed after 12, given all the preparation they have to do for the family. So despite the fact that this woman is sitting at the market all day long, when she gets home, she may not be getting the right level of nutrients and the right kind of a healthy diet that can sustain her to be productive and to really be able to support her children. Next slide and next slide. 2 forward. 2 slides forward, please. Next, before, the one before. The one before. Yes. Here, I just want to illustrate. Forward, please. Next slide, please. Okay. In the next slide, I just want forward, please. The next slide and next one. So in this slide, I just want to illustrate that food is abound. It is not the fact that the world is not producing enough food, but when it comes to accessibility and distribution due to economic limitations and infrastructure, many women and girls and young people are not able to access healthy diets. Next slide, please. Next slide, and the next one. Next one. Thank you. Now, there are a lot of constraints in terms of accessing healthy diets and consumption thereof by women and girls. Of course, we have natural disasters and conflicts and wars, and just recently, not quite finished, COVID-19, which affected, people's incomes, productivity, production, and all the other economic activities. And climate change. Women as carers and providers usually are the hardest hit by the circumstances and the outcomes of climate change. We know that this week at COP28, how much is really going to change towards the betterment of women and girls? Environmental and soil degradation leading to less productivity and poor infrastructure. And I want to emphasize here that we are not just talking about physical infrastructure, but soft skills in terms of planning and management and tailoring solutions that are well suited for girls and women. As soon as men see a tractor, they think they can be riding the tractor and using it. They leave the woman with the hoe on the farm. High input costs and lack of financial and other support. Do women have access to finance? Do they have enough to get microloans and everything that could support in their productivity? And low investments in high nutrient products such as pulses, fruits, and vegetables. And then the cost to consumers, because normally when there's a change, maybe it is during the lean season, fruits and vegetables that are of high nutrient are the first ones to go out of the basket. And then with the nutrition transition and globalization, we are not eating enough from the soil. We're eating highly processed packaged foods, high in salt, high sugar, and high saturated fat. Next slide, please. Next slide. Can you move? Okay. So we know that agri-food systems are very complex and very messy. And unfortunately, this exacerbates and makes the gender gap worse. So we all need to start thinking differently and thinking outside the box, have a new outlook, change the world order, and change the agenda, sustainably so. Next slide, please. Next slide. So now, what can we do differently? First, we have to start with the policy transformation. Are our policies current and relevant? Are they speaking to one another? Are we inclusive in the co-creation of those policies? We need to invest better in nutrition and come up with innovative financing, both from the private sector and from the public sector, so that we can support women and young farmers. How much are we doing in regard to subsidies so that we encourage the consumption of nutrient-rich foods and start producing them more and marketing them more? We can utilize, for example, the school gardens as for pedagogy, but also to promote more consumption and educate young people from early on, and then look at the element also of promoting the traditional and indigenous crops and food commodities, and then engaging with the media. Are we utilizing the media enough to address our issues? And then even if we can have all the money to address the gender gap, if we don't have enough capacities on the ground, we may not be able to succeed at what we intended to do and achieve all the action areas as Deborah highlighted them and alluded to them. Thank you very much.
Thank you very much, Bibi, from the Senior Nutrition Advisor at the African Union Development Agency. Now we'll move on to Action Area 2. It's all about integrating nutrition into care systems, in particular, health and social protection systems. To help shed more light on this, please welcome Dr. Shobhanti Ghosh, Senior Technical Advisor for Nutrition at Alive and Thrive. South Asia. Shabanti.
Thanks, Meera. Hello to everyone. Let me take you through the important intersection of nutrition and the health and social protection care system. Next slide, please. We have been all hearing about how it looks when it comes to the disproportionate burden of malnutrition that girls and women are facing in today's world. And we all know how malnutrition is an underlying factor, not just for poor health and well-being, but negatively impacts human capital development and adult life productivity. Evidence says that integrating nutrition in health and social protection systems has a multiplier effect. It results in holistic and high-quality care, and it will help us accelerate progress towards achieving the SDG goals. So when you have IFA supplementation integrated in the package of MNCH interventions, you will have a greater impact in reducing maternal and newborn mortality as well as stillbirths. Next slide. So what can we do on ground? How can we integrate nutrition in the healthcare system? We really need to focus on how well we can improve the coverage and reduce the inequities of health and nutrition service delivery. What we need to do today is double down on our efforts to improve maternal nutrition. We need to ensure essential nutrition interventions, inclusive of diet counseling, supplement provision and counseling, as was recommended in the WHO 2016 guidelines for ANC, so that we have a positive pregnancy experience, and the updates that followed are getting adapted in the country program. At the same time, we must be moving beyond women who are pregnant and lactating and reach out to all girls and women to prevent, detect, and treat all forms of malnutrition. The service delivery protocols need to include nutrition, screening, counseling, and supplementation services, and as well as integrate nutrition counseling along with the screening and the provision of the supplement that are needed, and addressing the risks that some women and girls have more compared to other women and girls. And we need to leverage existing contact points in service delivery and sometimes expand that. And it stretches across the life cycle, starting from preconception, antenatal care, postnatal care, when women are coming for well baby visits, immunization and growth monitoring, or for sick child contacts or family planning visits. And nutrition has to be a central element in the universal health coverage efforts. The next slide. So we have to be ensuring that what I was just referring, these services get delivered with quality. You know, nutrition counseling remains a missing link, and we do not have the defined standards of quality for undertaking contextualized counseling for nutrition. These needs to be put into place, and we really need to be looking at building the capacity of the health workforce both pre-service and in-service. Provision of micronutrient supplements. We need to increase access, promote its use, ensure adherence, and build the capacities accordingly in the health workforce. Similarly, the IYCF reinforcing on how do you really promote optimal IYCF practices. And it starts right from the antenatal period when you start building the preparedness within the woman and the family for early and exclusive breastfeeding. And we have to be focusing on how well we strengthen the implementation of the BMS code. And we must be accessing the barriers, understanding the barriers, trying to break those barriers so that the utilization of health and nutrition services by women improves. And these barriers are socio-economic, cultural, gender, and systemic barriers. The next slide, please. It's not just the health system, but also the social protection care system, which really needs to be more gender and nutrition sensitive and be able to mitigate the risks related to malnutrition. And we must focus here on two important things. There are a whole lot of actions needed, but social, economic, and physical access for not just food, but healthy, nutritious food has to be emphasized upon. And we need to expand access to maternity benefits for women, not just in the formal sector, but in the informal sector as well. The need for paid maternity and parental leave is very crucial when we are planning the social protection policies and program guidance. The next slide. So this was in gist of some of the key actions that we can take. And I will share very briefly something that we could do in India to ensure that maternal nutrition gets prioritized and integrated in the antenatal care delivery system. And this was a piece of work that Alive and Thrive, along with partners, took a lead to generate evidence through implementation research, then refine the understanding on the issues related to maternal nutrition and refining the solutions, and then working together with the national government and partners like UNICEF, Nutrition International to design evidence-based operational guidance and a toolkit to actually make it simple how you can, in the community-based platform or in the facility-based platform, really integrate a key package of maternal nutrition interventions, focusing on supplement provision, counseling, diet counseling, and very important, do a thorough nutrition assessment and identify women who are at risk and make it a part of the protocol for at-risk women during pregnancy or high-risk pregnancy protocol. And once it got designed, we are helping the various states in the country to implement the same. And at the same time, while we are working with the public sector, we have been reaching out to the Professional Medical Association, the Federation of Obstetricians and Gynecologists in India, to really sensitize the obstetricians wherever they may be working, particularly in the private sector, to prioritize and integrate maternal nutrition and women's nutrition in their clinical practice. So I'll stop here. Thanks.
Thank you very much, Dr. Shrabanti Ghosh, Senior Technical Advisor for Nutrition at Alive and Thrive South Asia. And very quickly, we move on to action area 3. Now, the urgency to advance the gender equality agendas as well as women and girls empowerment has not been this pressing in relation to girls and women's rights to nutrition. So briefing us on action agenda 3, please welcome Dr. Mandana Arabi, Vice President of the Global Technical Services and Chief Technical Advisor at Nutrition International. Welcome, Dr. Mandana.
Thank you, and hi, everyone. It's really great to be here and to be discussing this very important topic together with all the esteemed colleagues who have participated in this session. And yes, I'm honored to be talking about advancing gender equality in girls and women's empowerment with highlights from the work of my organization, Nutrition International. Next, please. So I won't spend too much time on the background, but just wanted to mention, while we are a nutrition-focused organization, like many speakers before, we see the gender equality issues as central to good nutrition. And we know that women and girls who are undernutrition have less access to quality education, lower income potentials, multiple barriers. So it's about also coexistence of many vulnerabilities at the same time. We also, specifically at NI, have a strong interest in working in adolescents and adolescent girls' nutrition linked to also gender issues and sexual reproductive health and rights. Good nutrition is critical for making progress on gender equality and supporting girls and women's empowerment, as we agree. Next, please. Again, we discussed this before. As we know, this is a multitude of different nutrition, but also other factors that we really need to be dealing with in talking about women's and adolescents' gender and nutrition linkages. We know that anemia, for example, as a nutrition and health issue that has been really mostly focused and really an issue of women, has not really made a lot of progress in terms of being reduced at the global level, even when it has been one of the Sustainable Development Goals. And we know that this really needs a special attention. All the way to issues in terms of information on sexual reproductive health, food security, nutrition information, education. We know adolescent pregnancies are also issues that we have to deal with, which would be about nutrition, but also many other aspects of the young women's well-being, and also the specific issue of also how we reach out of school adolescents, which they have definitely higher risk of nutrition deficiencies, health issues, and they're really not very easy to reach. And they are probably also where most of these vulnerabilities are coming together, and they have to be able to find ways to reach. Next, please. Again, of course, the action agenda has been really helpful in bringing this attention to how we really need to have a gender transformative framework to be able to have an effective response to gender equality and the empowerment of women and girls. And it has to be the central foundation for multi-sectoral response to nutrition within the broader gender issues. So we need to have multifaceted, multi-level change. This has to be all the way from policy, social norms, making sure that we strengthen participation, leadership, and voice, decision-making, voice and power of young women and girls and women in general. Make sure girls stay in school. We deal with issues of early marriage, violence, and also for sure engaging in the labor market and dealing with workplace rights and workplace support. So this, as you know, it's multifactorial and multifaceted. And of course, when we talk about gender transformative, those of us who are working also in programs, it's not easy. So that's the goal. That's really the vision. But let's see also how we can build stepwise towards making sure that we achieve this. Next. So that's why I wanted to talk about how we're moving at Nutrition International towards achieving the gender transformative framework. We've started from integrating gender responsive programming in all the components of our programs, especially, for example, programs that we have for adolescent girls, which are mostly on weekly iron and folate supplementation in schools. We make sure that these are also including things such as menstrual health, nutrition education, and using nutrition as an entry point for SRHRs. We try to increase youth responsiveness and gender responsiveness of health systems in general, making sure that the youth feel empowered to actually access the health systems and are able to be involved in their care and have a positive experience of care once they seek it. We support adolescents to be advocates for their own nutrition and their rights to access the health services. We also encourage participation and active engagement of adolescents in program design, and making sure that we use digital interventions to access this for the youth to access services, information, and tools for behavior change. And we've done this trying to also look at, the different country contexts and what is the kind of access in different social, groups to digital technologies. And in general, I would say, even in Africa, even in countries where you probably wouldn't expect, when we look at data, you see 40–60% of adolescents have access to digital technologies, have mobile phones. So these are platforms that increasingly are becoming important for influencing the rights and also really, accessing the young women and making sure that we can improve the overall health, well-being, and nutrition of adolescents and young. Next one. So again, I wanted to talk about our experience because as we are moving, of course, towards becoming gender transformative, that's the kind of gold standard approach. We have to start from really strengthening our programs, from the even simple basis of making sure that all of our programs have sex and gender-based analysis. So we started this, and in the past 2019 and 2020, we were able to conduct this across all of our programs, make sure that key gender inequalities and inequities in access to nutrition-related health and rights and health-related rights are addressed. Household communities, relationships, health provider systems, structures, and policies. So we look at all of these and how they are affecting gender inequalities. And then we developed a gender action plan, which includes key actions to address inequities, opportunities for supporting adolescents' girls' empowerment and meaningful engagement, and opportunities to promote gender equality with nutrition as an entry point. Next, please. So overall, this is our program, Gender Equality Strategy, and we want to make sure that this is a strategy that allows us to promote gender equality, women's empowerment, and improve nutrition. Next, please. And I just wanted to give you a snapshot of some of the tools that also we have made available to the global community. So these are tools that are related to, good practices, toolkits for nutrition programs. If you want to do sex and gender-based analysis, for example, that has been something that we use for our own assessment. We found it helpful. So these are also all available, and you can make them, you can access them through the Nutrition International website. Next, please. Also, we have a whole gender equality toolkit, as I noted. So these are tools that help you with landscape analysis, as I said, sex and gender-based analytics and project analysis for projects, how you can make sure that you work with experts to actually kind of embed their work in our programming, how to assess and select partner organizations, and also annual project gender equality review tool, which is something that we find helpful in allowing us to see how we are making progress. And these are tools really that help us kind of in a stepwise way go through a whole organization, make sure that we are really elevating the importance of gender within our programming. But as I noted, this is really a path towards that transformative change that we all need to contribute to. So really excited also to be part of this conversation, to have really to support the Women's Action Agenda and to really see an agenda that brings multiple elements of nutrition, but also puts it in the context of the broader situation of women and girls. So we are committed to support the work moving forward. I think that's the slide, and thank you very much for your attention.
Thank you, Dr. Mandana Arabi, Vice President, Global Technical Services and Chief Technical Advisor at Nutrition International. Thank you very much for that. Dr. Mandana, unfortunately, will not be able to join us during the Q&A session. However, if you have any question for our other guests, please put them into the chat box and I'll be happy to address them during the moderated session. And finally, action area 4 on the need to strengthen the multi-sectoral policy environment with an emphasis on the importance of data. Please welcome Sunday Okoronkwo, Executive Secretary at Civil Society Scaling Up Nutrition in Nigeria, better known as CS Sun. Sunday.
Thank you so much, Ma, for the opportunity to present. I want to thank everyone for giving us the opportunity to be able to share our Nigerian experience around the topic before us today. I think I'm going to look at it from the perspective, please next slide, from the perspective of the other speakers that just finished speaking, healthy diet, health and social health, and then gender equality. If you look at every one of these areas, you find out that each and every one of them has one thing or the other to do to contribute to improving the nutritional status of women and girls, which brings us to the idea that it requires a multi-sectoral approach to win the battle against malnutrition and probably close gender nutrition gap. Next slide, please. Next slide. Next slide. Multi-sectoral coordination, like we said, is actually a deliberate collaboration among various stakeholders. As mentioned, sectors like Ministry of Health, social protection, gender, and the rest of them. Each of them has critical role to play in closing the gender nutrition gap we have globally. And in order to promote this multi-sectoral policy environment we're talking of, one of the first things we need to look at is the importance of data. As we've heard from several speakers, when it comes to the issues around women and girls, the data, available data is very scanty. And as we know, this is valuable for decision making. If you look closely, you'll find that mostly in those policies, surveys, and studies more attend to maternal and child nutrition, but most times you see little or no data around adolescent girls' challenges around nutrition. And these has to change if we must close. Like, please. Next slide, please. Okay. Next slide. Okay. The importance of data. Now,
Sunday, are you there? We've lost you. Sunday? Sunday? Just bear with us. Is Sunday coming back on? No? Okay. Okay, we've lost Sunday.
Microphone is not on.
Please. Hello.
Hi, Sunday.
Sorry.
We lost you. We lost you for a fair bit there.
Yeah, I think it's network issue. Apologies. So the first thing we need to do is, like we've seen, is how do we promote evidence-based policy for multiple, sectors that have one role or the other to play in promoting nutrition among women and girls and closing the gender nutrition gap. One of the key things is that we need to integrate policies across board. There are nutrition-specific sectors, but there are also sectors that are not nutrition-specific, but they have to become nutrition-sensitive, that is, mainstream nutrition into what they do. We have sectors like education, health, agriculture, employment, and the rest of them. As presented by the speakers before me, if you look at the first three action agendas, you find out that nutrition has to be mainstreamed across board for us to close the gender gap. And also, each of these policies must be gender responsive. That is to say, must ensure that issues that pertains to women and girls are prioritized and proper attention is paid to their welfare in order to close this gender gap. Next slide, please. Next slide, please. Thank you. Funding for women and girls nutrition is also another critical point of things that would promote, our closing the gender nutrition gap. One of the things we noticed, some of the policies that are available, you see a mention of interventions that relate to women and girls. But when you come down to where the fundings are provided for the budget, you find out that no appropriate funding is provided. In cases where they are provided, they are grossly inadequate. And so in order for us to close the gender nutrition gap, looking at it from the multisectoral angle, sufficient funding, adequate funding across these sectors must be provided. And the essence of it is, it would not just providing the budget, also we must ensure that these fundings are tracked, monitored, and ensure that they are utilized for what they were meant for. The essence is, if this is done, it will promote accountability across these sectors. And the end point is that monies will be utilized for what they are meant for, and it will contribute to the optimal nutrition that all women requires and should get. Next slide, please. Next slide. Now, coming home to Nigeria, one of the things we did looking at the global action agenda was how do we contextualize it in country. And one of the things Alive and Thrive did, or also supported the Alliance Today in Nigeria, is they had conducted a policy gap analysis. We also did some following. And at the end of the day, one thing is clear in that there's no national guidelines where interventions across sectors, synergy across sectors, funding across sectors, or who will take charge of monitoring how these interventions work is domiciled. And one of the key things that came out is there's need for the country to have a national guideline on empowerment for women in order for them to achieve optimal nutrition. And so the first purpose of that guideline is how do we bring together all the sectors and policies and ensure that within those documents, within those sectors, program plans and strategies and also fundings are put in place in a coordinated way to ensure that women and girls nutrition is promoted. Outcome, of course, will be how to ensure that at the end of the day, we have more women in decision-making positions. I'll shock you with some data. In Nigeria, for example, when you look at the 10 senates that just came on board, you find out that only 2.7% of women are in the Senate where it comes to making decisions that concerns women. Out of 109 senators, we have just 3 women in the Senate in country. What of the House of Representatives? Out of 360 House of Rep members, you have just 17 of them, representing just 4.2% of women representation. And so this kind of guideline is required to see that women, are given the opportunities to, aspire and attain, positions where they can make decisions for themselves. And also in the country, we have schemes, government schemes that is supposed to empower both women and men. But if you check most of these schemes, you find that the men have more access than the women. And then, of course, when it comes to the issues of quality education, the norms in some parts of the country, paints a picture that makes us think that the male child should go to school rather than the female child, which is wrong. Now, these guidelines are poised to change some of these challenges in country. Next slide, please. Next slide. Next, okay. Now, the development of the Nigerian guideline, like I said, it came out of a robust discussion, decision across sectors in the country. The first part of it was a organization that has one thing or the other to do in order to improve, the nutritional status of women and girls in the country. It had organizations across board, UNICEF, Alive and Thrive, and the rest of them were all part of it. And it was agreed that this policy guideline will sit in the Federal Ministry of Women Affairs. They will be like the central body where, the coordination takes place, where the document will sit, and through the synergy will be built effective coordination across board. And to end that part of it, we had to bring stakeholders from across the country. Nigeria has 6 regions. We had to make sure there were representatives from the 6 regions of the country. And then currently we have that document. The 0 draft has been finalized. The next step to it is a formal validation and a launch where the Minister of Women Affairs in the country will launch that particular document. Next slide, please. Next slide. In conclusion, creating a multi-sectoral policy environment that is having, policies across sectors where nutrition, optimal nutrition for women and girls is mainstreamed into those documents, operationalized and funded. It's very important. It's very important because if all sectors don't key into this, it will be impossible for us to close the gender nutrition gap. Thank you very much for me.
Thank you very much. Thank you, Sunday. And we're going to move quickly into our panel discussion. And we have 4 of our panelists, Sunday, Deborah, Shabanti, and Bibi joining us. I'm going to very quickly kick off with some of the questions that you have put in the chat box. The first one being, how can we promote healthy diet for women when they live in an environment of equality and are expected to enjoy their rights on an equal footing with men? What do women do to bring about this change? I'm going to put this to either Shabanti or Bibi.
Okay, thank you very much for the question. Actually, I already put a response on the on our group, but the rest of the people cannot see it. So what I'm saying here is that we should first and foremost be very intentional about how we deal with issues of diet in the home. For instance, the division of meals. How much share do women get? How much share do girls get? How much share do children get? And then also looking at the division of labor, women tend to be bearing the brunt of the work. And so I think there has to be a very intentional effort to ensure that women are given the opportunity to be able to rest so that they can be better nourished and take some break so that they're physically and mentally well. And then I said also that, there has to be also, we have to ensure that there is a way in which there is a co-creation of solutions. Men should not be left out, thinking that when we educate women, we are doing everything, but we also have to involve men in some of these conversations and discussions so that 1, they are aware of the problem, and 2, they can know the solutions, and 3, they can contribute towards what solutions are workable in a sustainable manner for the households and the communities. Over.
Okay, thank you very much. Shabanti, your experience in Uttar Pradesh, perhaps, would you like to share that with us in relation to this question? Shubhanti?
Yes, I think the issue here is how we have the discussion focused with a deliberate intention on understanding the intra-household gender dynamics, because in India and in Uttar Pradesh and in many countries in South Asia or Africa, the patriarchal norms influence the intra-household dynamics related to food procurement, food cooking, and serving and distribution. So for this, it's essential that we work with the men in the family, the influential men in the community, to change the societal norms, because men are also conditioned in a certain way when it comes to how the food is going to be procured, who cooks, who serves, who eats, when, and how much. And also the social conditioning often affects women. So the elderly women in the household, the mother-in-laws, you know how between generations, the issues of eating, last, least, and worst continues. And how you really, have the conversation going on within the family, between husband, wife, between the mother-in-law and the man and the woman in the family, that is her son and daughter-in-law, on what is being procured, what is being cooked, how it is being distributed, and how is the woman eating in the house, or how is the girl eating in the house. The tendency of preferring to give the best to the son or to the young boys, that's something we had to work and had to create platforms where we could discuss with the men in the family, the husbands, and bring in the local male leaders into the discussion to change this or address these normative constraints both in men and women simultaneously. Over.
Thank you. Thanks, Shubhanti. Sunday, is there a central platform for nutrition data to be used for all users like that of the District Health Information System globally? Your thoughts on that?
Well, I would speak from the Nigerian perspective. In country, we have the DHS, a platform where health data are collected. You get some aspects of nutrition data within the system, but not, there are still gaps within the system. But the country is currently working on developing a nutrition dashboard. It's at an advanced stage currently. It's going to be a multi-sectorial dashboard where nutrition data across sectors will be, uploaded from each of the sectors that has one thing or the other to contribute to improving nutrition in the country. When that is up, it would actually help the country understand what the true drivers of malnutrition are, because currently, the eyes are, everybody looks at most of the data showing that from the health sector. But when you look at the agri sector, WASH and the rest of them, we don't really have quality data that speaks to the level of their contribution to driving malnutrition in the country. So that system is currently being developed, and I believe when it is finalized, it would go a long way to strengthen decision-making around a reduction in malnutrition, but focusing also on, women and girls, because in the country, with the work Alive and Thrive and CSN is doing, and other partners, UNICEF and the rest of them, some of this gender nutrition gap is being brought to the fore. and the attention of the government and policymakers, are focusing on what do we do to change the narrative in the country. Over,
Okay.
please.
Shubhanti, I have a question. In the case of Uttar Pradesh, how did the health system inform policy in the end? Have you been successful at all?
Yes, as I mentioned, while Alive and Thrive was undertaking the implementation research in Uttar Pradesh, simultaneously we were working with the national government, the Ministry of Health and Family Welfare, to provide inputs based on the continuous learnings that were getting generated from the implementation research, how we can develop the protocols for integrating maternal nutrition package in the antenatal care platform, both community and the facility-based service delivery. We work towards developing, the toolkit, the job aids that frontline workers and providers would need, worked on the capacity building plan as well. And it has been in principle endorsed by the national government. And in India, where state is a health subject, states are moving ahead with help of partners. Not all states right now, but several states with support from development partners in rolling out the integrated protocol. So things are moving, but it's a long way to go. We are also working with, public health nutrition institutes and government to develop an e-learning course focused on maternal nutrition integration in ANC.
Okay.
Over from.
Sure. Thank you. We just to look at the pay gap, gender pay gap in Latin America, there's a question here. Having a salary does not guarantee food and nutritional security. So the question here is, do you have any kind of experience in this regard? Would it be possible to negotiate minimum wage, focusing on gender and food security of the working population? That's a very good question. Deborah, would you like to give this a shot?
Sure. Yes, thank you, Mira. I think this is really such a critical question where we know that, as you know, income does not equal good nutrition. And I think that's been pointed out by the person who's asked this question. And one of the areas in the action agenda, we specifically call out action around the control of income as a critical issue. And so I don't have a specific response on an example of a setting or a case study where we've seen to negotiate a minimal wage focusing on gender and food security, but I'm sure they are there, but it's not one that we unearthed while we were doing the action agenda itself. And we did share the link here in the chat for the Gender Nutrition Gap website. And as you'll see in the action agenda, there are several case studies, and on the website there are also resources and links to some of the key action areas. And so in the area of gender equality, there are several resources that have been shared, and they do certainly highlight the access to income, and ability to earn a livelihood, etc. So I don't have an exact answer on an example of where this has been done, but certainly it is something that has been highlighted in the action agenda, that it isn't just about having enough food or having enough income. It's the combination, and I think it's, as it's been said, it's the combination of those vulnerabilities and having both the ability to control resources and at the same time having the access to healthy diets and other services that make up the change in this disproportionate effect on women and girls' nutrition. And absolutely, income is a key component of that. And we have seen even in the UNICEF nutrition report, a strong emphasis on the impact on malnutrition for girls and women. And there is some even data in that report indicating, as we have seen from Emily's presentation, the access to income and the relationship between income and food security. Thanks.
Okay, there's another question addressing the menace of processed food and soft drinks that's growing rapidly. I think that's just happening all over the world. Bibi, there is also, I always go by this where there's a saying that, they say, don't eat what your grandmother doesn't really recognize. How do we get through to communities that nutrition exists around them? And if you could reference perhaps indigenous food and the work you've done in your area.
Thank you, Mira, and thank you to the person who asked the question. Absolutely. I always say we really should go back to the basics. And more than enough research has shown that over the years, as I mentioned, the nutrition transition, we have shifted away from our traditional and indigenous foods, which they may not have been all good, but for the most part, because they were natural, organic, and they were not overly processed, they were good for our bodies. And the other thing we should be thinking about going back to basics is, why are we limited globally to only 4 staples, namely maize, wheat, rice, and Irish potatoes? Whereas in Africa, for instance, we have a lot of small grains such as sorghum and millet, fonio and teff. Yet we are not fully optimizing their presence in the food basket. So we should not eat what our grandmothers could not eat. And we should not put in our bodies, which can be rejected by our bodies, leading to overweight and obesity and non-communicable diseases. So it's a very simple equation: garbage in, garbage out. So let's go back to the traditions and promote and make sure that the policies are actually supportive of the production and the harvesting of these food commodities. Over.
Great, thanks for that. And in terms of digital, I think there's a question: how do you mainstream digital response to adolescent nutrition? Is there a particular tool that you're using to drive this? I think this could be for you, Sunday. Sunday, are you there?
Yeah, I'm here.
Yeah.
Hello?
So the question
Yeah,
being,
I can hear you, please.
Yeah. How do you mainstream digital response to adolescent nutrition? Is there a particular tool that you're using to drive this?
Hello, over. We don't really have a particular tool, but we make use of the available to, especially the social media space. As you know, the social media seem to be the place, especially for adolescent girls. And part of what CSON had done is we have what we call Tuesday Tweet On. It's a campaign that happens every Tuesday, and for each of these Tuesdays, 2 Tuesdays in a month, we take up topics that are related to both women and girls, and other topics aimed at improving nutrition, educating the populace and these young ones around the challenges of malnutrition and some of the things they should know to avoid or overcome some of these challenges. And the truth is that the response had been wonderful. A typical example is during the COVID-19 era, part of what we were pushing for is the multi-sectoral plan of action for nutrition, getting it passed and endorsed by the government. But as you know, movements were restricted during that period. So we had to come up with a strategy of using the social media platforms to both engage these government personnel and also engage, the populace, and also target women and girls also. And the results were amazing. Before the COVID-19 ended, even within that period and restrictions, were still able to pass information messages at targeted groups and got results even while restrictions were there. And also we also have integrated use. The Sun Movement have integrated the voices of the youths into our work. We have the National Youth Coordinator in the country who works very closely with the Secretariat. And about a year ago, we concluded a project where we had the Youth Ambassador of Nigeria sitting within the Secretariat. And the core component of that project was how do we get the young ones, educate them around nutrition issues, educate them on how to, avoid being malnourished and the rest of them. And we utilized social media channels. We also engaged the traditional media, talk shows on radio, and even on televisions. Now, the idea was getting the young people themselves to disseminate this message, pass the message across, hold stakeholders meet themselves to educate them on what these issues are. And so we may have not have designed a specific technology or app, but we've been able to leverage on existing ones where you have so many of these young girls, using these systems to educate them around, optimal nutrition and overcoming the challenges of malnutrition in the country. Over.
That's all the time we have for our Q&A session. So a huge thank you to all our panelists and speakers. Now for her closing remarks, can I please welcome Dr. Nadra Franklin, Vice President of Global Nutrition at FHI 360. Dr. Nadra.
Thank you so much, Mira. And thank you all for joining our webinar on closing the gender nutrition gap, an action agenda for women and girls. Each of the sessions today has been a valuable piece of this comprehensive puzzle, from the situational analysis to the 4 pivotal areas of the action framework. I really appreciate your active participation, your thoughtful questions, and engagement during the webinar. All of this contributes to the transformative impact we aspire to achieve. I would like to express my sincere gratitude to the Swiss Agency for Development and Cooperation, SDC, the Government of Ireland, and Save the Children UK, the coordinators of SUN CSN, for their invaluable support. Your commitment has been indispensable, and we're really truly grateful for this partnership. Thank you.
Thank you,
now
Dr.
let's carry these insights forward, implementing positive changes in our spheres of influence. Remember, this is not just a webinar, it's a catalyst for change. So thank you for being a part of this meaningful dialogue. Until we meet again at the second webinar, stay inspired, stay informed, and let's collectively pave the way for a healthier, more equitable future for women and girls worldwide. Thank you.
Thank you very much, Dr. Nadra. With that, we come to the close for the first part of this webinar. In the second part of the webinar series on closing the gender nutrition gap, we will explore how to apply the action agenda on a country and global advocacy level. We look forward to having you same time, Monday, the 11th of December. And thank you very much for joining us this evening.
Thank you all. Thank you very much. Have a lovely afternoon, evening, morning.
Bye-bye.
Thank you all. Bye-bye.
Thanks, everyone.
Thank
Thanks,
you.
everyone.
Thank you and goodbye.
Thank you. Bye.